everybody. I'm Michelle Copley. I'm an integrative therapist, which just means that I'm trained and qualified to work in different ways so that I can choose, with your help, the best one for you and your situation. One of the things I get asked about a lot is online therapy, how it works and what are the benefits. And so I'm going to talk a little bit about that today. I actually started working online by accident, really. A therapy client of mine who I'd been seeing in person, because of the progress she'd made in therapy, it has to be said, was offered this amazing job, but it meant a move to London, which is like 200 miles away. So she was wanting to take the job, but was concerned that she wouldn't be able to manage without her therapy. So she asked me if I would consider working online with her, which I'd never done before. I'd always worked in person. I was a little bit dubious, but because I wanted to support her and because I thought it was the right thing that she did continue with her therapy to help her through that, I agreed. And we started working online, and it was perfectly normal, the exact same process as in person. And she carried on and progressed further and finally finished her course of therapy online. And that was before the pandemic. When COVID hit, everybody was forced online. And so everybody now really knows that working online is having meetings, etc., is the same as working in person. So that's how I started working online, purely by accident. I personally still do both in person and online work. And as I say, I find that I get the same results either way. So what is online therapy? Well, you may hear it called online therapy or remote counselling or online psychotherapy. All these things are the same thing, and they really all do what they say on the tin, which is bring counselling or therapy or psychotherapy to you over the internet using some kind of video platform like Zoom, which is the one I use. This allows you to have therapy at a time and a place to suit you, specifically a place that is comfortable and feels safe for you, like your home, whilst the children are asleep, even in your lunch break, work, anywhere where you feel comfortable and you choose, you can have therapy. The process of therapy is the same whether you have it online or in person. So it's the exact same course of treatment that would be chosen, the same training and qualifications applied to the therapist, the same professional standards, the same ethical guidance, the same accrediting bodies. So I'm, for example, with the BACP, and that applies whether I work online or in person. So how does online therapy actually work? Well, you'll email first of all and ask for your free initial consultation. And between you and the therapist, you'll decide on an agreed day and time. And then they'll send you through an email with the Zoom link. That's the platform I use, but they could use a different platform. It's all the same. And that enables you on the day and the time agreed to click on the link, and it'll take you straight through to the platform that you'll be using. For me, I always use a password so that only you and I will ever be allowed into that session. And then you just start talking, just as I'm doing now. You'll, for that first free consultation, the therapist will ask you details about yourself and what your issues are, what you would like help with, and you'll be able to ask any questions that you have from your end. They'll give you an idea of how they think they can help you, and then it's up to you to decide if you want to proceed or not. If you want to proceed, you make another appointment, usually for the next week, but not always. Again, we recognise that people have different situations, different lives going on, and so again, it will be agreed between you and the therapist when you want to have that next session, and you arrange it between you, and you'll get another Zoom link and off you go again. And that's the process of it. It's very simple. You don't need to be a technical genius. I'm definitely not a technical genius, but it works very well. And that's one of the major benefits of online therapy, actually, is that we're not constrained to office hours. We can make our days and times in the evenings, some weekends, so that it's more accessible for you. And that's actually one of the reasons I like working online, is because it makes it much more accessible for people who need it when they need it. Which brings me on to the other benefits of online therapy. The benefit that people are always talking to me about, so it seems to be the major advantage of online therapy, is that people aren't having to add travel time and travel cost onto the cost and the time of their actual therapy. People can get straight home from work, have something to eat, and then go straight to their therapy session, rather than having to juggle everything else around travel time and getting to the place. So that actually seems to be the thing that people mostly appreciate about online therapy. And the other benefit that's on a par with that is that you're having therapy from a comfortable place, a comfortable environment where you feel safe. And that's really important for people, especially for some people we know starting therapy is a difficult process for most people. And it's even more difficult if you're going to find it uncomfortable going into a place that you don't know with people you don't know. Online therapy takes that whole thing away, so that you are comfortable, you feel safe in your own environment, and that actually, I believe, helps the process of therapy along. I've even had people who've continued their therapy when they've had to travel for work, for example, or even a chosen holiday. It can be daunting for people to have a break of a week or 2 weeks if they're not sure about not having their therapy, and knowing that that can continue if they choose to, by just taking a laptop or a tablet or a phone with them, is really reassuring for people. One of the major benefits of working online, I believe, is that it enables you to choose to work with somebody who specialises in your area of need. So things like OCD, panic attacks, PTSD, chronic pain, bereavement, these things all really need someone who is knowledgeable in that area of work and who is experienced to know how to help you in the best way. And working online enables you to choose somebody who specialises in that area wherever they are and wherever you are. And I think that's really important. And then finally, something that people have mentioned to me and they find really important is that you're not going into a building that says counselling or therapy or psychotherapy above the door. And so Joe Bloggs down the road, who might happen to be in town at the same time and see you going in there, they won't be doing that because you won't be going in there. You're working from your own home. So nobody knows, unless you want to disclose that to them, that you're even having any counselling. And that's really important to people. It makes it their decision whether they choose to tell people or not, rather than be, in the words of one lady who spoke to me, found out unexpectedly and asked about it. So what can be helped with online therapy? Well, the answer to that is everything that can be helped with in-person therapy. We use the exact same tools and techniques, the exact same process. As I said before, it's the exact same professional standards and ethical guidelines. So the process of therapy itself will remain the same. And if there's any kind of exchange of information to be done that would normally be given to you in paper form, it just happens over email. So the whole process is exactly the same, apart from we're doing it like this rather than sitting opposite each other in an office. So how do you prepare for your sessions? Well, that's really easy. You turn up at the agreed time and you have your hour where you can be undisturbed and you start to communicate back and forth. You don't have to wear a headset, but you can if you choose. Your therapist will do the same. The only crucial factor is that you have good audio. So that you're not constantly having to, I'm sorry, what was that? And you spend half the session going back and forth, not really hearing what the other person said. That's the crucial bit. Having said that, you don't need to be a technical genius. You don't need any specialist equipment. Modern laptops and phones and tablets have all the requirements you need to be able to have an online session. You don't need anything special. We absolutely understand as therapists that starting any process of therapy can feel really daunting for people. You might not know if you can be helped. You don't know how you would be helped. You might not know where you would even start in the process. And all of these things can make it feel an unsurmountable thing to even begin therapy. I'm going to do a video separately about that specifically. But for now, I'll say that online therapy really seems to help people with that whole beginning therapy process, because you're not going to a building that you don't know with people that you don't know. You're sitting in your own home or whatever environment you choose, and you are comfortable and safe, and that really seems to help people. So those hurdles of having to travel, go to a building you don't know, to a person that you don't know, they're not there. You're just sitting in your own home or wherever you choose, somewhere you feel safe, and you begin to talk online. And that helps people to start the therapy and proceed with it and progress in a way that sometimes they can't even do the starting bit in person. So if you'd like more information or would like to book your free initial consultation, just contact me at the details you can see on screen. Bye for now.